Okay, we're ready to get started. So thank you for joining us this afternoon. I think we probably have the largest audience that we've ever had for one of our webinars. So obviously caregiving is something that's near and dear to everyone's lives right now. So our session today is coronavirus preparedness for people with chronic diseases. What do caregivers need to do, need to know? And it's my pleasure to also recognize the National Alliance for Caregiving for co-sponsoring this webinar with us and for being involved in the planning and helping us identify the right speakers. Next slide, please. Just want to recognize the membership of the National Health Council. These are all of the patient advocacy organizations that are in our membership and are all united and very strong through this this time of the corona crisis. And so we want to acknowledge all of them for all of the great work that they're doing. Next slide, please. Someone has joined and they are on their computer and their phone at the same time. Be sure that one of them is muted. You cannot have them both on audio at the same time. It causes echoing. Thank you. Just want to let you know and remind you that we have set up a web page on our website for resources about COVID-19. Please be sure to go there and check out all of the many resources that we've put there. Most recently, we've put a couple of things that I think are very useful. People have been hearing about about Plaquenil, the older drug that has been talked about as a potential treatment for COVID-19, and we put up there a one-page piece of information from the Maryland Poison Control Center about the toxicity of that medication and how it needs to be kept away from children. And so please be sure to look at the wealth of resources that we have on this website. If you have questions related to public policy, be sure to reach out to Eric Gasho, who's our Vice President of Policy and Government Affairs. And if you have any questions about HR policies and procedures or other best practices, then please reach out to Susan Gaffney, who is our new Vice President of Membership Development and Operations. Those are our resources that are available to you. Next slide, please. So the objective of our webinar is to talk about how the patient groups are assisting their members and other constituents in reducing the impact of COVID-19. And we want to be sure that we have enough information out there for all of you about preparedness, how to avoid the illness, what to do if people are sick, and what patient groups can be doing to help field inquiries from their members. And so today we have a special focus on caregiving because we know that that's such an important issue for many of the patients and patient groups that are out there. Can you please switch to the next slide? Just our disclaimer that media inquiries should be sent to Jennifer Schleiman, who's our Assistant Vice President of Marketing and Communications. She would be happy to help you. And please contact the National Health Council before quoting any information from this presentation. The information is rapidly evolving. We want to be sure that we're giving you up-to-date information. As I said earlier, the webinar today will be recorded, and so it will be available at a later time. Next slide, please. If you have any questions during this webinar, please use the chat function. There are so many of us on the line today, it's not going to be possible for us to be able to have any kind of a conversation or have people ask questions in person. And so please be sure to use the chat function to ask your questions, and we will try to cover as many as we can during the question and answer session. Next slide, please. So I want to introduce our speakers for today. I am Eleanor Perfetto. I'm the Executive Vice President for Strategic Initiatives with the National Health Council. I want to introduce Grace Whiting. Grace is with the National Alliance for Caregiving, and that is our co-sponsor for today's webinar. Also want to introduce Beth Kalmeyer, who's with the Alzheimer's Association, Rachel Schrader, who's with Parent Project Muscular Dystrophy, and Adrian Schreier, who is with the Bipartisan Policy Center. Each of them is going to take roughly 10 minutes to give a short presentation, and then we're going to open it up for questions right after that. Next slide, please. So it's my pleasure to have Grace Whiting, the President and Chief Executive Officer from the National Alliance for Caregiving, kick us off with an overview. Grace, I'm going to turn it over to you now. Grace, you might still be on mute. Silka, can you hear me?
Hi, Eleanor. I can hear you.
Is Grace muted?
She is not.
Grace, are you there? Seems to be a little technical problem, Grace. Are you able to hear us? Would you use the chat function if you can hear us, but we can't hear you?
Hey, Eleanor, can you hear me now?
I can hear you now, Grace. Thank you.
Awesome. No, thank you guys so much, and apologies for that. Well, first off, let me just say thank you, National Health Council and Eleanor and your team for allowing us a chance to partner today. So I'm excited to give you some big picture ideas about sort of where we are with caregiving. And if we'll go ahead and move on to the next slide, just if you're not familiar with us, the National Alliance for Caregiving was founded in 1996, and we're a nonprofit coalition based here in the Washington, D.C. area. And we work on improving the quality of life for family caregivers and those in their care. And we do that through three ways: research, advocacy, and innovation. I would also just mention that we have a sister organization that we founded called the International Alliance of Carer Organizations. So these are NGOs in 16 other nations. And what we do is try to ensure that the United States is keeping pace with that global best practice. So on the next slide, I'm going to talk to you a little bit today about caregiving. Now, when we talk about caregiving, we typically are looking at folks who are caring for another individual because of a chronic health care need, because of a physical or functional limitation, or because of an illness or serious injury. And we don't typically talk about, for example, parental leave when we talk about caregiving, although parental type issues sometimes come into play, particularly when there are kids with disabilities or rare diseases or other types of conditions that have functional or cognitive limitations. When we look at all the people in the United States who are providing care to someone else, we estimate in work that we've done with AARP that there are 43.5 million family caregivers in the US. And if we were going to take every one of those caregivers and replace them with a home care worker, that economic value would be $470 billion a year. So if you're sitting there thinking, how do I grapple with how big that is? I am a huge musical theater nerd, and I always think to myself, okay, it's about 44 million people. That's roughly the same size as all the people who live in Argentina. And I always remember that. I think Evita, Argentina, we've got 44 million caregivers in the US. So it is one of the largest unpaid volunteer workforces that exist in our society today. Now on the next page, we're going to talk a little bit about, again, how big is $470 billion? So what you see here is a comparison of economic analysis from AARP. So that's more than we spend on GDP related to education and the arts. It's more than we spend on agriculture. It's more than out-of-pocket spending on healthcare, and more than the total paid LTSS and Medicaid LTSS. So the point here is that we have this huge workforce that we rely on to be the backbone of our long-term care system. And in many situations, that workforce is not adequately prepared to care because they don't receive the support that they need. Let's go to the next slide. So, and you can keep going to the next slide past the picture of the family. So what is it that we're facing as a community right now? Well, even before the pandemic, one of the things that was on the radar, at least from our perspective, is that the way that we think about family support in the United States is siloed. we have one set of paradigms that I would describe as a healthcare paradigm. And this is where we recognize that the caregiver or care partner, other terms that your community may use or not use, that they are part of a functioning care team, whether that's a healthcare team, a long-term care team, and they're providing services to someone to help them manage their activities of daily living. In doing so, we see healthcare systems recognizing that role of the caregiver as part of the care team and supporting them through programs such as the Medicaid Home and Community-Based Services Waivers Program, sometimes called self-directed care. So this is where we say, okay, caregiver, we recognize that you're part of this healthcare system, and we're going to make it easier for you to provide high quality care to the patient. On the other side, we've got social care paradigms. And this is when we evaluate how families and family responsibilities should be supported in our society. So for example, the Older Americans Act has a program called the National Family Caregiver Support Program. And this program is administered by the area agencies on aging. When that program is administered, it doesn't matter who the patient, quote unquote, or the person living with the condition is, because it's a program that recognizes that caregivers have their own unique needs, their own health and wellness issues, and that they need support. And we see also in this regulatory scheme, some programs that fall somewhere in the middle. And we'll get to why this is important in a moment. So let's go to the next slide. So I want to put you in the mindset of a caregiver. Now, I would bet money that several of the folks on the call today either are caregivers, have been caregivers, are anticipating becoming caregivers. But just to back it up with a little bit of the research to put you in the right frame of mind. So there's a fantastic researcher out of the University of Washington, Dr. Frances Lewis, and she developed an intervention for families who were caring for someone with ovarian cancer. In this pilot study, she looked at heterosexual married couples. So women had cancer and the men were the caregivers. And one of the things that she's discovered in this body of research and the additional follow-up research is that in many cases, families may perceive the strain that a disease puts on their family as a conflict with the relationship. So they say to themselves, why is that person always being so negative and complaining all the time? And the person who has the condition is saying to themselves, why does the caregiver never listen to me? Or why is the caregiver trying to solve things that they can't solve? And that idea that people sometimes perceive that strain as being the burden of the other person rather than the burden of disease is present in several different types of caregiving. Next slide. In the same vein, a lot of the interventions for families work on helping people reframe that pressure so that we can get to a place where we say, okay, this isn't about me versus you, or you being cranky, or you're not taking your medications, or this person keeps nagging me to go to the doctor, but rather this is about us versus the disease. You and I together are going to work on managing this disease. Next slide. So with that in mind, from a caregiving perspective, we see a number of typical caregiving challenges. Now, I put this in quotes because we do work across a lifespan. We've looked at mental health caregiving, rare disease, cancer, dementia, aging and frailty related issues, you name it. And the reality is that caregiving is not one size fits all, but you can, from a research perspective, bracket it into certain challenges that people tend to experience again and again. One is living with someone else versus long distance or facility-based caregiving. How do I care for someone in a facility? One is helping with activities of daily living, care coordination, and medical nursing tasks. How do I do the activities of care? There's the strain of disease on the family, things like fatigue, having conflict or misunderstandings because of the disease. There's financial impact and impact on work and career, and particularly the income security of a caregiver as they get older, or of the person who had to step out of the workforce because they needed care. And then the impact on behavioral and physical health of the caregiver. how does it impact their own ability to maintain good health, to fight off chronic disease, to stay, in a mentally good place? Those are the types of challenges we see in caregivers across the board. Now, on the next slide, I think what's important to remember is that what COVID-19 has done is sort of added an extra boom on top of those everyday challenges that caregivers have. And some that immediately come to mind that we've seen come up over the last couple of weeks: uncertainty about disease impact and the timeline, which increases the stress of those trying to provide care; quarantines, which limit the ability of a family member who might be providing care to actually go and visit that person either in a facility such as a nursing home, or to visit them in the hospital if they're receiving care for COVID-19, particularly in cases of advanced illness. There's also issues where dependent care and child care supports are no longer available. So people are finding themselves sandwiched between elder care responsibilities or adult care responsibilities and caring for minor children who might be living in the home. Many people have increasingly been facing potential job loss, which may cause long-term career damage and income security damage, and they have no way to replace income that they were using to help pay for the cost of care. There's also been issues related to restricted access to medicine, equipment, and care providers, and increased concern about self-care and health. And we're seeing more and more people trying to grapple with these issues of worry, anger, anticipatory anxiety, and even grief. Now, on the next slide, the other big challenge, I think, for our communities, and again, there's a little star there. So this is not true all the time in all the cases. But when we talk about chronic disease, whether it's dementia, whether it's mental illness, whether it's aging, related disorders and diseases, it's somewhat of a predictable curve. It's not always predictable. There may be some type of inciting incident, so to speak, that thrusts you into the caregiving role. But in general, particularly for more prevalent diseases, we have a sense of what's going to happen and that it will increase in intensity over time. Some big exceptions would be cancer, rare diseases where, maybe we don't know a lot about the disease journey, relapsing, remitting conditions that are autoimmune. But in general, when we talk about chronic disease or multiple chronic conditions, we have some idea of how to predict that. Now, on the next slide, the second big challenge we see from COVID-19 is that there's two big challenges. New uncertainty. So if you're already a caregiver, the pandemic has introduced new uncertainty into your caregiving journey. And then the second thing is that we have brand new caregivers. We have people who are now taking on trying to manage infectious disease of their loved ones, and they've never been a caregiver before. So those challenges, I think, of sort of the additional caregiving stress that's put on the individual, and the fact that we've got the new group of caregivers makes this a particularly challenging time for friends and family members. Now, on the next two slides, we have some resources that we've been directing people to. And what I would say is, more than ever, this is important to get out information to families that is from trusted, credible resources and that does not cause them to panic. Because while we want people to be aware, we want people to be tackling this and to prepare for what's ahead of them, we also want people to be well enough from a mental health perspective to be able to weather what's going on with caregiving. And the last thing I would say is, a lot of times we forget that many, many family caregivers are living in this crisis mode day in, day out. And there's a lot of interesting research that talks about how caregivers actually develop resilience and are able to weather crises in their life. And they've been doing it day by day for however long they've been caring for the people that they love. So I would just encourage the community, as we think about this, as this conversation evolves, to remember that we have some experts in our midst who have lived experience that can talk about how they've been able to manage their caregiving journeys. And it's a huge opportunity for the rest of us, not only to engage them, to reach out to them, to help them feel less isolated, but to build off of that lived experience rather than reinvent the wheel. So that's it for my opening remarks. Thank you again, National Health Council, for hosting this, and I look forward to the other presentations.
Thank you so much, Grace. So everyone, we are going to be there will be a recording posted of this webinar and the slides will be posted. So don't feel like you have to write all those resources down. This information will be made available for you. And now I'll turn it over to Beth Kallmeyer, who's Vice President of Care and Support with the Alzheimer's Association. Beth?
For people with dementia and what those specific things that you need to pay attention to that are different than the guidance that we're getting from CDC. Those are the things we, of course, should be following. But what are those things that people caring for someone living with dementia should be paying attention to? So next slide, please. So one of the things that we get asked a lot at our 24/7 helpline is, are people living with dementia at higher risk? And what I can tell you is that they're not at higher risk because of having dementia, but they are at higher risk because most people that have dementia are over the age of 65. And we know that the risk is greater, the risk for COVID-19 is greater the older you are, and if you have those other chronic comorbid conditions. Some other things that caregivers might want to pay attention to as well is that some of the dementia-related behaviors and some other common health conditions could increase the risk for dementia for people, for COVID-19 for people living with dementia. Next slide. So again, we really stress that everybody needs to follow those CDC guidelines around hand washing, around hygienic practices. But the things that you want to keep in mind if you're taking care of someone that is living with dementia is that they might need some additional help to do that. So if you think about it, to think about maybe putting a schedule in place for hand washing, right? To help that person living with dementia to remember to wash their hands. That person, depending on where they are in the course of the disease, might need additional help to actually wash their hands for 20 seconds. We've suggested putting up little notices or signs in the bathroom and at the kitchen sink where people are typically washing their hands to remind them to do it for 20 seconds and for the caregivers to sort of supervise that to make sure that that's happening, because we know that that's one of the most effective things that we can do from our homes. Next slide, please. So another thing that we're talking to caregivers about for people living with dementia is it may be that that person can't communicate with you about some of the symptoms that they could have if they've been infected. They might not be able to articulate that they have a sore throat. But one of the things that you might see is sort of a sudden change in their level of confusion, a sudden change in their cognition. If you see a sudden change, what we're asking is that you call your healthcare provider right away. Some people we've heard stories of people going into emergency rooms right away, and unless there's an emergent situation with difficulty breathing or a very, very high fever, we think that it's recommended that you should call your healthcare provider to ask where people should be treated. If the symptoms aren't severe, they could be treated at the home, which is safer for everybody. Some other things that caregivers can do, and one of the most important ones, I think, is if you're a caregiver for someone living with dementia, please think about what an alternative care plan would be if something should happen to you. Caregivers do a great job, but this is something that they often don't think about. But with COVID-19, I'm sure that it's on the minds of many. And so get your family together on a conference call and talk about what would happen if, because if the caregiver does get sick, it's better if you have discussed a plan ahead of time. It's a lot easier than when you're scrambling if somebody gets sick. Next slide, please. So I also wanted to share some tips for caregivers who have a family member that's living in a residence, either an assisted living, a senior living, or a nursing home. Because there's been many restrictions on visitors at those residences, it's been really difficult for caregivers. They often visit on a regular basis, they participate in care, and they're very worried about what's going on if they can't go visit. One of the things that we're telling those caregivers is, while this is hard, this whole situation is difficult for everybody, but the most important thing is to keep folks that are in those types of residences for seniors, we need to keep them safe. It is so dangerous if an infection starts in one of those residences. It's so hard to keep that from spreading. So it's really critical. And so what we're suggesting is that you work with that residence and that long-term care organization to ask how it is that you can stay in contact with the person that is your family member, the person that lives there. Many of those organizations have set up video conferencing, telephone calls. Of course, people with dementia might need additional help. They might not be able to make a telephone call, but talk to the residents, find out what it is they're doing to help support that. Even in the end, if it's just an email that can update you every day on what's happening, those are things families can do now. So if you have not heard from a residence where a family member of yours might be, I would suggest reaching out to them as soon as possible and finding out what that plan is. Next slide, please. And lastly, I just wanted to tell everyone about a resource the Alzheimer's Association has. We have a 24/7 helpline, which is staffed with information specialists, master's level social workers, and counselors. Anybody can call with any type of situation. I've seen many of the chat questions that are very specific to your situation. If you're caring for someone with dementia, we're happy to problem solve with you. There might not be an easy answer, but we can help you weigh the pros and cons and make a plan that works for your family. And we're there, as I said, 24/7, so you can call day or night. And that's it for my slides right now.
Beth, thank you so much. Can we have the next slide, please? So now about caregiving for children. Rachel, I'm going to turn it over to you. Rachel Schrader, Senior Vice President for Clinical Care with Parent Project Muscular Dystrophy.
Hi, everyone. Hopefully you can hear me okay. It's great to join you all today. Thank you so much to the National Health Council for having me. Let's go ahead and go to the next slide. All right, so there are definitely some things to think about when the person that we're caring for is actually a child, right? So children in general tend to be very low risk for COVID-19. So I think that oftentimes is a very reassuring thing to think about. We know that children, if they do become infected with COVID-19, they're very low risk. They typically have really mild symptoms, or they might even be asymptomatic entirely. But then subsequently that does put them at risk for potentially spreading COVID-19 to other family members who might be at higher risk. So these are things to keep in mind. But on the other side of that same coin, if your child does have a chronic illness, there are unique sets of risk factors that accompany that potential diagnosis. So with our population, we are an advocacy group for people that are affected by Duchenne muscular dystrophy, which is the most common type of muscular dystrophy. It is a pediatric illness seen mostly in boys, and it is life-limiting. So with our patient population, they do have specific risk factors, including immune compromise secondary to the use of systemic steroids, cardiac dysfunction, and pulmonary dysfunction, among others. So with that in mind, I would encourage the caregivers on the line today to consider what specific risk factors your child may have that could potentially put them at higher risk for complications from COVID-19. That pediatric component often is a protective feature, but we have to consider the entire picture when we're caring for our children as well. From there, I always encourage my families to keep an open line of communication with their medical providers for guidance on how to tackle any potential complications that could arise from infection with COVID-19, or even other issues that might arise related to the child's diagnosis unrelated to a potential COVID-19 infection, because sick children can oftentimes still get sick and need medical care regardless of what else is happening in the world. So some of the recommendations that we've been providing to our family include things like using lung volume recruitment at home and working with their doctor to make sure that they have adequate stress dose steroids on hand if they were to get sick. This can look like having conversations with your physician about how to avoid going to the hospital if they get sick, or how to use telemedicine for well or sick visits. One of the recommendations that we're making is to stay away from the hospital at all costs possible. That can be really challenging with somebody that has a chronic diagnosis. But we do want to, of course, minimize exposure and minimize risk for potentially coming up with COVID-19 if at all possible. But secondary, if they do end up with a COVID-19 infection or some sort of other complication related to their illness, we're recommending please have a plan in place and know what that plan is so that if you find yourselves in an emergent situation, you're ready to go. So knowing who and when to call, if there are special phone numbers that you need to have on hand, or what the plan is to try to stay at home as long as possible, and then what that plan might look like if hospitalization does indeed become required. We're also trying to help streamline access to resources for our patient population, and I know a lot of other organizations are doing this as well, so I would encourage caregivers on the phone to go to those different resources and use them as best you can. At PPMD, we've created a COVID-19 landing page for families to go, and it's essentially one-stop shopping in the search for good, safe, reliable information about COVID-19, both by itself and how it interacts with Duchenne and what people could expect if they were to find themselves in those situations. I would also encourage people to consider additional resources available to them, whether it's through their own medical providers or their local children's hospital that they go to for care, and of course using the federal, state, and local health agencies as well. CDC, of course, has a great website, including, I've got it mentioned here, their own children and coronavirus webpage specific to kids, their risk factors or lack thereof, and everything that goes with it as well. Next slide, please. Okay. So with children, regardless of whether or not they have a diagnosis underlying that puts them at risk for COVID-19 complications, there's this really, really important component about talking about it with your children in an age-appropriate and developmentally appropriate way. We want to make sure that we're having these conversations with them proactively, because so many times children will often go to the news or go to, YouTube or, whatever's going on the internet or on TV, and they might hear things that are really scary but not fully understand what that means. And oftentimes when they don't necessarily have all of the pieces and parts to make sense of what they're hearing, they'll fill in the blanks. And this can oftentimes look like making things in their minds seem like it's really, so much worse than what it actually is. And the media is really, really scary right now. So we want to be sure to be monitoring how much news and media they're consuming and make sure that we're having those proactive conversations with them so that you can answer their questions and help address their fears. This can look like helping them understand their diagnosis. So with us in our organization, we're encouraging families to talk about COVID-19 and Duchenne. What does this mean for you? Why are we staying at home? Why are we not going to school? Why are we... maybe somebody could mute themselves.
Hi, please mute yourself. Be careful. It sounds like someone has joined with both their computer and their phone. That's what causes the echo. Be sure off.
All right, very good. Okay, I think we're better. Perfect. Okay, so let me jump back in. Where was I? So we were talking about monitoring news consumption, media consumption in our children, and helping them understand their own risk factors, but again, in an age-appropriate way. So if you have a child with Duchenne or some other sort of diagnosis, talk about what that means, what that looks like, and how we're going about this as a family to minimize our risk and understand why we're changing our behaviors and practices. This is why we want to stay at home. This is why we might not be able to go to school. This is why we're seeing our friends on Zoom instead of at playgroups, things like that. And then give them action items. So let the children understand, this is what's happening in the world. I've had this conversation with my mom or my dad or whomever takes care of me. And give them opportunities to take action. So learning about washing hands and singing, whether it be, Baby Shark Doo Doo or Happy Birthday for 20 seconds, learning about good hand washing practices and doing their part within their community and engaging in things like social distancing, even though it can be really scary and confusing and not a whole lot of fun. And keep in mind too, how are you feeling? How are you handling the stress and the anxiety of caring for a medically fragile child in the context of a global pandemic? That's really scary, and that's okay. But make sure that you're thinking about your own stress, your own anxiety, and how you're coping. Kids see this, kids pick up on this, kids can feed into this, and we have to be very cautious to balance these things, and that can be really, really hard. But with that in mind, you're the gatekeeper. So make sure that we're monitoring how much media they're consuming, we're having these proactive conversations, and we're talking about ways to manage the stress and anxiety surrounding this really scary time. Again, check with your different advocacy organizations to see what resources they have for helping you have these conversations. We at PPMD, we're actually going to be hosting a webinar here in a couple of weeks on managing stress and anxiety in relation to COVID-19. We will, of course, have that Duchenne-specific spin, but folks are welcome to join if you want to have a longer conversation about that. And then the image that I have to the right is actually a link to the Brain Pop video. This is a great resource. I don't know if folks on the line are familiar with Brain Pop, but it's a really great explanation of coronavirus COVID-19 infection in a way that isn't necessarily scary or panic-inducing, but is educational and still straightforward and fact-oriented. Next slide, please. All right, so finding normalcy in a world where nothing is normal. I know that our organization, like many others, is really trying to provide a little bit of that normalcy for our families. So even in the context of caregiving and chronic illness, we still have to go forward with our days, but those days probably look really, really different. So we have to consider, how to balance these things. Maybe you've got job loss in your family, or maybe you're working from home for the first time and you're trying to balance working at home or not having that employment income and then having children within the home because they're not able to go to school. That can be really tough to figure out how to balance. So we're encouraging families to create a routine, schedule out your day, provide that consistency and that predictability so that you can make some normalcy out of a very unnormal situation. And do things as a family while you have this extra time together. That can be really hard to do when you've just got all of these different things going on, but we're encouraging families to have some activity time together to really hone back in on that family unit or that caregiving dyad and spend that time together and not necessarily think so much about what's happening in the outside world because it is so scary. The image that you see to your right is a screenshot from our current website. So one of the things that we're doing at PPMD, we're providing an ongoing living document of sorts with different family activities to help provide ideas and thoughts and suggestions of things to do to structure educational time within the home, physical activity as able, and help to provide a little bit of solace and structure to the day. And please know that a little grace goes a long way. We're in really uncertain and new waters at this time, and that can be really challenging, but let's all be sure to give ourselves a little grace because things are not going to be perfect as we navigate what this new normal looks like for the time being, and that's okay. That is okay. All right, I think that's all I have.
Thanks, Rachel. So we'll go to Adrian now. Next slide, please. So again, Adrian is a fellow at the Bipartisan Policy Center. Adrian?
Hi, Eleanor. I just want to confirm you can hear me.
Can hear you just fine. Thank you.
Wonderful. You guys can move to the next slide. So I thought I'd take a quick second. At the federal level, a handful of really big stimulus packages have moved through Congress. The first is signed into law, and the second will pass the House today and likely be signed into law this afternoon. I'm going to focus on a couple of the provisions that seem to have a lot of a lack of clarity and misunderstanding, but in particular are focused on helping workers and employers understand what these laws say and how you benefit from them. So in the Families First legislation that is officially law, there are two provisions. One provides paid sick leave and one provides paid family leave. The paid sick leave is 2 work weeks or 10 paid days at 100% of your wages if you're staying home for yourself, and 66% of your wages if you're staying home to care for a loved one, up to $511 a day. A second piece of that is paid family leave, which is an expansion of FMLA. It's job protection for 12 weeks. It's actually 10 weeks because you use the sick leave first, but and it provides 2/3 of your pay, up to $200 a day. But not everyone is covered. So I will just pause there and clarify. There is paid sick leave. Paid sick leave has broader qualifications for who can benefit from it, and there's paid family leave. So move to the next slide. Here's the kicker with the law. It only applies to workers who work in a company or an organization that has 500 or less employees. If you work for someone that has 500 or more, they are not beholden to this law. Also, in the next 2 days, we will get guidance from the Secretary of Labor, who has the power to exempt companies with 50 employees or less, and also exempt healthcare providers like hospitals and nursing homes. So we could see a huge portion of the workforce, specifically the professional caregivers and kind of health medical focused caregiver workers, exempted from this benefit. It covers full and part-time workers, gig economy, self-employed. And what happens is, instead of a government program that gives you a check, this is a mandate on your employer. Your employer has to provide this leave if you qualify and if they qualify, and then the government pays them back 100% for those expenses in the form of a tax credit. Next slide. Just to go into a little bit of detail on paid sick leave. It's 10 working days or 2 work weeks, 100% of pay if you're sick with yourself, like if you're sick with yourself, and 2/3 of pay if you're taking care of someone else. And I did list here the reasons covered because I find this extremely confusing. If you are subject to a quarantine or isolation orders, if you have been advised by a health provider to self-quarantine, if you're exhibiting symptoms or seeking diagnosis, most importantly for our caregivers on the line, if you're caring for an individual for one of the reasons above, or a child because school is closed, or there's a whole plethora of other, but these are the top line ones, you qualify for this paid sick leave through your employer. Next slide. The second program is paid family leave. So as you know, FMLA or job protection writ large usually applies to 3 different bodies. It applies to new parental leave, it applies to family caregiving leave if your loved one is a qualifying recipient, and it applies to your own medical need if you yourself get sick. This is an expansion of FMLA. It for family members that are taking care of someone under the age of 18 because school has been closed related to coronavirus. Their employer is required to both protect their job and pay them 2/3 of their wages to not exceed $200 per day or $10,000 in total. And then I shared a little bit about like what a son or daughter, a child is a qualifying under FMLA law here. But these are the 2 that are signed into law. If you go to the next slide, they take effect on April 1st, and they are in place until the end of this calendar year. The employer, because I know we have a lot of nonprofits and small businesses on this call, if you are beholden to this mandate, you get a dollar for dollar reimbursement in the form of a tax credit. The law that's pending today, that will hopefully be signed into law today, helps increase the expedience with which that tax flow or that flow of resources comes to employers. I will say there is very strong enforcement and anti-retaliation protections here for workers. So know your rights, and there are signage requirements for employers that the Department of Labor will have out hopefully today, but at least by Monday, to help employers understand this and to help employees understand their benefits. Hysterical thing for me about signage requirements is there's nobody actually physically going to work to see those signs, but I'm sure they'll come up with creative alternatives. So that's the extent of my presentation on what has gone into law to date. And I'm happy to work with the team once other things are signed into law today to share. But for the most part, this is the the broad nature of the paid family and paid sick day laws that are in these two bills.
Thank you, Adrian. And I know we actually didn't post the signage, but we actually sent it out to everyone in an email and posted it in our in a place where everyone can access it on the internet. So we are trying to do our part in that way. Well, I want to thank all of our speakers. Thank you so much for their presentations. We don't have a lot of time for questions, but I do want to tackle a few that quite a few people have sent in questions that have the same theme. So Beth, I'm going to direct this one to you. If you have a family member who's in a facility, like an assisted living facility in particular, what's your recommendation, or what are the pros and cons of keeping them at home or leaving them in the facility?
So, as you can imagine, a really difficult question and hard, obviously, to give a one-size-fits-all answer. But I would tell you, I would have a conversation with my family. I would talk to the facility. Some of the things you need to look at are, can I provide the care safely at home? Is that a viable opportunity? It may not be for many people, right? So it might not even be an option. I would also, look at what's happening in your community and what are the things that the residents has done to address safety and reducing risk. So I think you would want to take all those things into account and then make a decision that's best for you. Certainly our helpline staff would be happy to problem solve that through with anybody that wanted to call.
Great, thank you. Rachel, I have a question for you that's come through about people who have children at home, and it may be that the parent gets ill and they need to isolate from the family or from their children, but they might live in a circumstance where they have to share bathrooms or a bathroom, and they have to share the kitchen. So what advice are you giving out for those kinds of circumstances where the parent or a family member has to isolate, but they have very shared living space that they have to deal with? What's your recommendations there, or what kind of advice are you giving?
So I know oftentimes this is a very imperfect situation, and we would like to be able to have, really, really great designated quarantine spaces within the home. And it's not always practical to be able to do that as in this situation where perhaps there are shared spaces within the home. If there is the ability to use cleaning supplies, we would recommend things like masks for the person who is sick. So if you're well, a mask is not going to help you. But if you are sick, a mask will help to protect the people around you from getting sick. Additionally, we would encourage the typical recommendations that you see. So wiping down surfaces that are touched frequently, washing of hands, minimal person-to-person contact as able. I know that this is really challenging, and sometimes there aren't necessarily other people in our lives that we can go to rely upon for help. Honestly, you just have to do your absolute best and make sure that you do have a good plan in place if perhaps somebody in the home does become sick and requires hospitalization as well. Like I said, I know that's not a perfect answer, but you just have to do your absolute best.
Thank you. So I have one question that I think many of us have been asking or thinking about. For those people who are direct caregivers or direct care workers, you're going to work, you may be caring for people in their home, or you may be caring for people in other types of settings, but you're caring for people who are positive. And should you be isolating because you know you are exposed to these positive individuals? There are many questions about going home each day and going home to your family when you've been in contact. Should those caregivers who have been in direct contact with patients they're caring for, should they be self-isolating? And that was open to any of the speakers that we had. Sorry, I know I didn't name anyone because I thought any of you might have a response to that one.
This is Grace from National Alliance for Caregiving. One thing I would just mention is, and this is going to depend a lot on your locality, but in a lot of localities, you can go and get tested if you feel like you've been exposed to the virus, or if you're caring for someone who's at a higher risk. And it'll depend a little bit on your insurance provider and where you live. But I think the first step is just to make sure that you're connecting with your individual healthcare provider and getting as much information as you can. A lot of health providers will also have an advice line where the advice nurse or care manager can kind of walk you through a triage to see and evaluate what your risk is. So it's hard to give specific information because it's going to depend on so many different factors, you know, how you live. Like my husband and I, we're in an 800 square foot apartment. So we've kind of, if one of us gets it, we're both going to get it, but that's not an ideal situation for most people. So I think it depends so much on your individual circumstance. Your best bet's probably going to be to call your healthcare provider or your local public health department and get some advice about the specific situation and how you might be able to get tested to get diagnosed to see if that's really what's going on.
Thanks, Grace. Anyone else want to jump in on that one? I had another very, go ahead, Rachel.
No. So this is Rachel. I was just thinking about, so within our Duchenne population, we do have patients who get weekly IV infusions for certain FDA-approved drugs within the home. And that's kind of similar to the situation where we've got, nurses coming into the home and then going back to their own homes. So some of the things that we've been recommending are use of masks, gowns, gloves whenever possible, removing outer layers, so jackets, shoes, things like that, whenever they enter the patient's home to provide that level of care. And then when getting home, a lot of our parents have been doing things like, as unpretty as it is, stripping down when you get home, heading straight to the shower, going ahead and putting laundry directly into the washing machine, things like that, to minimize that exposure as much as possible. We are experiencing that with parents who still have to work outside the home, but then come home where there is a medically fragile person within the home. And so those are some of the different practical pieces of advice that we've been recommending. And again, I would definitely say speak with your provider, speak with your local health department if there are specific recommendations for your situation, but those are some of the practical tips that we've been advising.
And Grace and Beth, you might have some thoughts on this one. Also, Rachel, if you're hiring someone to come into your home as a caregiver or a home care helper, worker, what are the kinds of things that you would want to be sure that you're asking them? And what are the kinds of things that you'd want to be doing to make sure that the people that you're hiring to come into your home are not bringing the virus into your home?
This is Beth. I can just say that there's no guarantee that someone's not going to bring it into your home. So I think that's the premise that you need to start with, and so then you make a decision based on how much do you need the care, and some people are going to, right? But people need to understand that there is no guarantee there. But I would absolutely talk to the home care agency and ask them what they're doing. They could be taking, employee could be taking their temperatures every day. They could be using protective equipment. They could, wash their hands, do some of the things Rachel was talking about. There's different steps that can be taken to mitigate against the risk. And I'd want to make sure that the agency was in helping their employees take all those steps.
And this is Grace. I would say so home care is a term that can mean a lot of different things. It could mean, you've got someone coming over to do sort of companion care or to help you clean the house, all the way up to skilled nursing and home care doctors and PTs and OTs in the home. So it's going to depend on what type of home care services you have. The other thing I would note is that CMS is issuing new guidance on home care workers to try to alleviate some of the challenges that are facing people who don't want to go out and go into a hospital or facility to get care. And one thing I would say it's sort of talked about a lot in the long-term care community is that the best place to get sick is a hospital. Now, I don't know that that's true, but for some people, if you're at higher risk, it may be that being at home in that environment is safer to have someone come to you than to go out. And that's, again, something you want to bring back to your healthcare provider. The other thing I would say is that Dr. Anthony Fauci, who is the head of the infectious disease division at the NIH, has done some really excellent interviews where he answers some of the questions about how does the virus work. And I'm going to post to the chat here a link to one he did actually with the Daily Show on Comedy Central. It's a clean interview, so nobody has to worry about, blushing or anything like that when you listen to
offensive materials.
right. Very clean interview. But Trevor Noah, who's the anchor there, just asked a series of questions like, can I do this? Can I open packages? And I think the more you can look to the CDC and the coronavirus.gov page, they're going to have the best information on, the public health piece of how do I keep myself safe and my family safe.
We're running out of time, so I'm going to close this with one last question. And it's, if I'm self-isolating at home, if I've been staying close to home as much as possible, haven't had anyone coming into my home to visit, do I really need to be worried about washing my hands several times a day or making sure that I'm following all of these practices if I'm fine and my family members are fine and we're at home and we haven't had any contact with anyone outside our home? Do we have to be quite as diligent as the CDC recommendations sound?
So I'll just say quickly, this is Grace again. This is one of those moments where it's not just risk of the virus, but also risk of other infections. So practicing good hygiene, great hand health and skin health and cleanliness is really important, because what you don't want to do, and I had this conversation with my mother. My mother, she loves to fix things around the house. Every now and then she'll topple off a ladder or, and I said to her, Mom, no, nothing creative right now, right? Like now is not the time to try really new dangerous hobbies, because what you don't want to do is end up having to go into an urgent care or an emergency department where you might get exposed to the virus when you've been safe at home.
Great advice, Grace. Thanks so much. I want to thank all of our speakers, and I want to thank all of you for joining us today. We will be, the National Health Council is happy to be putting on these webinars, and we will be planning another one within the next couple of weeks, looking for suggestions on topics. For any of you who have more information that you're looking for and things that you want to know, just let us know and we can concentrate on those issues. Thank you all for joining us. The webinar will be posted, the recording will be posted, the slides will be posted, and we will also take many of the resources that our speakers provided today, and we'll put them in our resource page so that you'll have access to them. Everyone stay safe. Have a great weekend. Bye.